Popliteal artery and tibial arteries anatomy guide for medical students. 1. Popliteal artery, origin continuation of the femoral artery, begins at the adductor hiatus in adductor magnus. Course, runs through the popliteal fossa behind the knee, ends at the lower border of popliteus muscle, divides into anterior tibial artery, posterior tibial artery. Branches. 1. Genicular branches, 5 total. Supply the knee joint and form the genicular anastomosis. Superior lateral genicular, superior medial genicular, middle genicular, supplies cruciate ligaments, inferior lateral genicular, inferior medial genicular. 2. Muscular branches to hamstrings, gastrocnemius, soleus, plantaris. 2. Anterior tibial artery, origin branch of the popliteal artery. Course passes anteriorly through the interosseous membrane, travels down the anterior compartment of the leg, becomes the dorsalis pedis artery on the dorsum of the foot. Branches. 1. Anterior tibial recurrent knee. 2. Muscular branches anterior leg muscles. 3. Lateral and medial malleolar arteries around ankle joint. Zone of supply anterior compartment of the leg, tibialis anterior, extensor hallucis longus, extensor digitorum longus, fibularis tertius. 3. Posterior tibial artery, origin larger terminal branch of popliteal artery. Course, runs down posterior compartment of the leg, passes behind medial malleolus and tarsal tunnel, divides into medial plantar artery, lateral plantar artery. Branches. 1. Fibular peroneal artery, lateral leg. 2. Nutrient artery to tibia. 3. Muscular branches, posterior leg. 4. Malleolar and calcaneal branches. Zone of supply, posterior and lateral compartments, gastrocnemius, soleus, tibialis posterior, flexor hallucis, and digitorum longus. 4. Fibular peroneal artery from posterior tibial. Supplies the lateral compartment of the leg. It also gives perforating branches that contribute to ankle anastomosis. 5. Arterial anastomoses of the lower limb. At the knee, the genicular anastomosis involves 5 popliteal genicular branches. The descending genicular from the femoral, the descending branch of the lateral circumflex femoral from the profunda femoris, and the anterior tibial recurrent from the anterior tibial. At the ankle, the malleolar anastomosis involves the anterior tibial malleolar branches, posterior tibial malleolar branches, fibular artery branches, and the dorsalis pedis terminal branches. At the foot, the plantar arch is formed by the lateral plantar artery from the posterior tibial and the deep plantar branch of the dorsalis pedis from the anterior tibial. It supplies the toes via the plantar metatarsal and digital arteries. Clinical relevance. Popliteal aneurysm may compress the tibial nerve leading to pain or foot drop. Peripheral artery disease or PAD often affects the popliteal or tibial arteries. Posterior tibial pulse palpable behind medial malleolus. Dorsalis pedis pulse, palpable on top of foot lateral to extensor hallucis longus. Summary table. This video made by Karthikeyan, medical student from VSMU.